Hello, everybody. Welcome to today's training. Today, we're going to be covering health procedures. First of all, I want to welcome everybody back from summer vacation. If you were on vacation, if you are a new employee, well, welcome to the agency. Hope you guys enjoyed here with us, and give you a warm welcome to the Niños family. Today, I'm going to go ahead and introduce myself. If you don't know me, I've been with the agency, well, going to be in the agency for 4 years in November. I've been working with the health department for roughly about a year now. I just took over not too long ago, and before that, I was the special service specialist, working in disabilities for almost 2 years, and then before that, well, actually for 3 years, and then before that, I was a custodian at Santa Rosa. Uh, I've been for the, I've been, know a lot of information on quite a lot of different things. So if you all have any questions, concerns about anything, you can always feel free to let me know or contact me. So one of the first things that we need to get, there are going to be a lot of changes this year. If you all are familiar, we have a child health record, which is roughly about 10 pages. If you've been here, for a long time, you're aware that it's roughly about 10 pages. So this year it was reduced to only, let's see, only 4 pages, I believe, or I think 4 to 6 pages. A lot of information was removed, but I'm gonna go over what I think are the three most important forms in the health record, and just because it covers a lot of information for the child, that we need to know. For example, the first form, which is Form 1, it has all the general information on the child. Uh, this information here, we need to have this information on file. For example, child's name, their gender, their birthday, the head start that they are, and their address, and also has the parent's first name, last name, or their legal guardian and the relationship that they have to the child. We also ask for their primary language, for example, English, Spanish, or other. We do have, I think we've had some kids that are from Germany and China and stuff like that. So it's very important for us to identify what their primary language is. Also, we need to find out what type of services they're receiving, for example, WIC, food stamps, or any other state, services that they're receiving. We also need to make sure that when was the last physical. Now, this information is very important because we need to pinpoint, what their health requirements are, and we need to make sure that we're following, continue to following up with them. If, for example, if the child has an allergic reaction to something, we need to make sure to be aware of it. We also ask for the primary physician, the clinic that they're assigned to, their preferred hospital, and dentist, and all this information we ask for just in case of an emergency. We have to know that information. We also ask for the emergency contact for the family. Uh, Obviously, for a lot of kids, the primary contact, emergency contact is going to be the parents, and some people prefer to put their grandparents or etc. Now, I feel like this part is very important, which is going to be the conditions. Like I mentioned, we have to know any health conditions that the child may have. For example, severe asthma, diabetes, if they have seizures, if they have any type of allergies to certain bug bites, for example, mosquitoes, etc., or if they need to take any medication. Now, we also have asked for any health issues that maybe the family might have. For example, if the mom has heart problems or diabetes or high blood pressure or anything like that, we need to make sure to be aware of it just in case in the future the child does show some signs or symptoms. We are aware that there is a little bit of family history concerning that health condition. Now, Form 3 is going to be the physical. Now, this form is very important. This is the form that we provide for the parents so they can take to the physician, and it has all the major information that we need also here for Head Start. Now, I am going to cover it later on in the PowerPoint, but in the presentation. But I need to emphasize the importance of the physical and the dental, and we must have it on file. We need to have the child cleared for Head Start before they can come in. But one of the main things that we do need for the child is going to be a valid TB test in order for them to actually come into the center. And those requirements are not only in Head Start, but they're actually also in the public school. So it's very important that we inform the parents of this information. And one of the important forms is going to be this physical form that has to be filled out by the physician and ask all the important information, all the checks that they need to be done for the child. For example, their current height and weight, which we later use to calculate their body mass index or their BMI. We need to make sure whether they're, developing correctly, if they're a little bit overweight, underweight, or if they're normal for their age. We also need to have the blood pressure, the hemoglobin, the hearing, the vision results. We also need to have also under other, which is a TB test. That's actually one of the most important ones that we need to have on file. We also have the physical examination results, which will be the examination that the physician does. If the child has any skin rashes, if they have any vision problems, if they have any ear problems, or if maybe they have heart problems, lung problems, anything like that, the physician will document it on the physical, and we need to make sure that we are aware that we take the time actually. I know the family service worker does document this information on the folder, but it's also very important if you are a teacher or anybody in the center that we get to know our kids and actually review this form and make sure that we have an understanding of the child's medical conditions. So this form is very important. And like I'm going to mention later on in the PowerPoint, we do have a requirement by Head Start to have all this information documented, and a child must have a valid physical within 45 days upon enrolling. So as soon as the child steps into our building, we have 45 days to actually get the physical done and documented on file. And by done, I mean completed, and all areas of the physical must be filled out. So it's very important as teachers, family service workers, that we make sure that information is there in the folder. And the next form is going to be the child's dental. Sorry, the dental is also very important. I also want to emphasize that we need to also have this documented within 45 days. But it is also, we also think, I believe we have 90 days to also document it. But the big goal is to have it as soon as the child walks, as soon as the child comes in, we have all this information documented. We need to make sure that maybe they have any cavities, or any type of, you know, problems, with their teeth. We need to be aware of it. So this form is also very important, and we need to ensure that we have it documented in the child's folder. So we're going to go ahead and start off with the procedures. Like I said, a lot of the staff, if you are a current staff, you'll probably be aware of all of these procedures that we have in place. You'll probably all have experience doing it. Also, if you're a new staff, we're going to go ahead and go over a few procedures that we have to do. It's going to be pretty simple information, but we do need to be aware. And this is just going to be a quick refresher for everybody. Make sure that everybody's on the same page when it comes to all the different things involving the health area. So the first procedure that we're going to go over is going to be dental hygiene. Now, Niños Inc. Head Start and Early Head Start program will ensure that a child's dental health is maintained through toothbrushing. So children will be educated on proper toothbrushing techniques by the Head Start staff. Dental hygiene education curriculum will be followed to instruct the children and will be incorporated as per established timelines in the lesson plan. So teachers, it is part of your lesson plans to go over toothbrushing, and that will be a great time for y'all to read a book, actually demonstrate in the classroom on how to properly, brush your teeth. It is part of your lesson plan, so um, I feel like that's a very important lesson for the kids, for them to, for whatever reason the parents aren't teaching them how to properly toothbrush. I feel like us, you guys as teachers, can take the time to properly teach them how to clean their teeth, brush their teeth. So children will brush their teeth after breakfast and after lunch. Only 2 children will be allowed at a time per sink during the toothbrushing area. So it's very important that we understand that we cannot have too many kids in the sink at the same time. If there's only two sinks, we'll only have two kids. Just because brushing teeth it can also be a very big risk of contamination or spread of any type of disease if there is, for example, strep throat or anything like that. Brushing teeth will, if you have too many kids can get exposed if there is a child who might be sick or be carrying a sickness. So Head Start will provide toothbrushes for all the kids. We'll provide an infant toothbrushes for the infants, and we will provide a regular toothbrush for the toddlers. Uh, so, and we're also going to be providing fluoride toothpaste for the children as well. So each kid will have their own toothbrush and their own toothpaste. So no need to be sharing or anything like that. Each toothbrush and toothpaste will be named and have the name written on it. This is very important. Also, we want to avoid cross-contamination as much as we possibly can. So we need to make sure to label each toothbrush and each toothpaste with each child's name. Toothbrushes will be changed every 3 months. The first change will be done in November, the second in February, and the third in May, or as needed. I usually like to send extras to the centers just in case um, you have a new kid that comes in or a child has strep throat or anything like that. You're able to replace the toothbrush and the toothpaste. So that is no problem at all. So the next one is toothbrushes and toothpaste will be thrown away if a child is diagnosed with having strep throat, and a new one will be issued to the child. Toothbrush cabinets will be cleaned daily and will be disinfected weekly using minimal standards procedures for disinfecting, which I will be going over later in the PowerPoint. It's very important that we keep the toothbrush cabinet as clean as we possibly can. That's where all the toothbrushes and the toothpaste is going to be stored. So it's very important for us to keep it clean to prevent, any type of cross contamination of germs. Staff will make every effort to ensure that cross contamination of germs does not occur during toothbrushing. Children 12 months to 5 years old will brush their own teeth as long as they can spit and not swallow the toothpaste. And teaching staff will supervise and assist the children and apply a pea-sized amount of toothpaste, taking special care to encourage children to become independent during toothbrushing. So this is very important, and I want to emphasize on pea size. We don't want to put too much toothpaste on the toothbrush. So one of the key things that I want you all to remember is going to be a pea size amount of toothpaste. That's very important. And this is also a good time for us to allow the children to show their independence. Um, so toothbrushing is a great activity. Go ahead and motivate them. Tell them, you're doing good. You're doing good. You're a big boy or a big girl now. So encourage that independence in the kids. Let them be independent and show that they can do it as well. So next one is oral hygiene for infants will start at birth and will take place after lunch and will be maintained in the following manner daily until the child is able to spit, toothpaste, and toothbrush their own teeth. So this is going to be for the early Head Start teachers who do work with babies, with infants. We're going to be the staff is going to be doing the cleaning of the teeth until they're able to understand the concept of spitting out the toothpaste. So these are going to be the steps for those early Head Start teachers that do have babies on how to clean an infant's teeth. So first of all, the very first step is going to be to assemble your supplies, and we need to make sure to wash our hands because we are going to be putting your finger in their mouth. So it's very important to wash your hands, even though you're going to be wearing gloves. It's very important to wash your hands. The next step is going to be to put on your gloves. After that, you're going to gently rub the gums of the child with a gauze, moistening with water, making sure to clean the inside and outside of the gums. Also, we're going to make sure to take this time to inspect for any redness, any grayish color, any discolored patches, We do have any abnormalities, we need to make sure to document it in the child's folder, and we need to make sure to report it to the parents as soon as possible. And you will let your family service worker know that we need to document a referral for the dentist. We need to make sure that they follow up with that concern, or or whatever we find. We need to make sure that the parents follow up with it. Next step is going to be to throw away the gauze pad. We're going to remove our gloves, and then we are going to wash our hands afterwards as well. By the end of this, at the end of the school year, children will be given their toothbrush and toothpaste to be able to take home for the summer, and so they can also keep practicing while they're at home. And we're going to make sure that before school ends, we're going to encourage them to continue toothbrushing at home as well. So the next one is going to be the daily health check procedure. Now, Niños Inc., Head Start, and Early Head Start will ensure that children are healthy and able to participate in center activities, and that the health and safety of the center children and staff are secured by conducting daily health assessments of each child. Children will be checked every morning, preferably before the parents leave, to ensure that they are healthy and able to participate in the center activities. If the child is transported by Niños Inc., then the health check will be performed at the center unless the injury or illness is visible at the time that the child is being put on the Niños vehicle. Teaching staff must, at this point, make the parent or legal guardian aware of any findings. Teaching staff must make a determination if the child will be allowed to attend school for the day. Daily health checks are going to be the most important thing, not only for the child, but also for the staff. We need to make sure that if there's anything visible, if you notice that the child is showing that they have mucus, if they look like they have some signs or symptoms of illness, or if they have any injuries as well, we need to make sure to document them, and we need to let parents know as soon as possible. I really highly recommend that if you do see that the child has some type of injury or anything like that, make sure to let parents know as soon as possible. You don't want, it to happen to where the child gets home and you knew that the child, when he came into the center, he already had a hit or a little cut or anything like that, and then you didn't document it, but when he got home, parents saw it, and then they're gonna accuse you guys of it happening at the center. Now, it's gonna come back to you guys if we don't document it, so it's very important that anything that you guys see during the morning, as soon as the child comes in, or as soon as they get on the bus, we need to make sure that we check the child, and we need to make sure there are any findings. We need to make sure to document that information. Okay. Now, please refer to the exclusion procedures to determine if the child will be sent home. We'll go ahead and go over that a little bit later. And that's just going to be what types of injuries or anything like that will be able to exclude the child from actually coming into the center. Now, the morning health check will be documented in the daily attendance book. Each classroom will have their daily attendance book, so we need to make sure to document them there. Teaching staff may refer to the guidance of signs and symptoms of illnesses and injury in the health and safety tips section of the daily health binder. If there are no findings for that day, we can go ahead and put a check mark for your own documentation on the attendance. If there is some type of concern, then we need to make sure to document it um, in the daily health check, and we need to make sure that we fill it out on the morning health check form as well. And that form, the parents must receive a copy of that form in your findings for the child, and within 48 hours or as soon as possible. My recommendation is as soon as you guys have some type of finding, contact them as soon as you possibly can. Just because you do not want, any issues with any parents. So as soon as you guys have any findings, make sure to contact them as soon as possible. With that copy, the morning health check does have a white copy and a yellow copy. So make sure to provide the parents with the yellow copy, and make sure to document the white one in the child's folder. I've seen folders at the centers that are like binders, because some kids actually have uh, some men they have a lot of injuries at home. So as soon as we document everything, so it's very important to have that documentation on file. Okay. So the next one is going to be the diaper changing procedures. Niños Inc., Head Start, and Early Head Start were secured that children are provided with diapers while the child is present at Head Start and Early Head Start centers. Staff are responsible to ensure that children's diapers are maintained clean and dry while the child is in attendance at the Head Start and Early Head Start center. Now, we do provide all children with their diapers or pull-ups and their wipes. If the child has any type of health concerns, if they, for whatever reason, cannot use Huggies brand, they can only use the Pampers, or if for whatever reason it needs to be the sensitive wipes, we can provide those diapers and pull-ups with doctor documentation. So any type of accommodations that we need to do for the children, we will do it as long as we have the proper documentation. So make sure to keep that in mind because I've had people that say that we have parents bring their own diapers or their own pull-ups. Please note that we can provide any pull-ups or diapers or wipes that the parent, if the child has any health concern, any health issues or anything like that, but we must have documentation on file. Um, so keep that in mind. So I'm going to go ahead and go over the steps on diapering. Like I said, this is just going to be a refresher. A lot of the a lot of the staff that we'll be training, they've been here for years, or they've been here long enough to where they know all the procedures. But I am going to go ahead and go over them, just so we can make sure to have a good refresher and make sure that we know the information. Okay. So the first step is going to be to assemble all your supplies. That's going to be a clean disposable diaper or pull-up. That make sure to acquire all the wipes that you're going to need, and we need to make sure to have a diaper changing table. If you do not have a diaper changing table, you do need to have a specific mat that is designated for changing diapers only. If you do not have a changing table, and we also need to make sure that your changing table has the paper that goes on it as well. You also need to make sure to get your gloves. It's very important to have gloves just because there are a lot of infectious diseases that can spread through the feces of the children. So that's very important as well. Also, if there is a documentation by the parents, and if you do have consent from the parents, you can also go ahead and gather any ointments any rash cream or anything like that that you might need, powder, any baby powder, anything like that. But you do need to have consent from the parents in order for us to use um, that those items while changing a diaper. Step two is going to be to get your area ready, which is going to be your changing table or mat. We need to make sure to place the paper on the table so it fits the length of the child. We also want to make sure to leave at least 12 inches of extra paper from the feet, just so if the child moves or anything like that, you have enough paper still to cover any movement or anything like that. So, like I mentioned before, if there's no diaper changing table available at your center, for whatever reason, you do have to have a mat that's going to be designated for diaper changing only, and we need to make sure to label that mat for diaper changing only. It's okay. So it cannot be used for any other purposes, not even to just lay a child for a little bit. It can only be used for that reason only. So the mat will be placed on the floor or the restroom, and then we must follow the next steps, which I'm going to go over. Okay. Now, step three is going to be the actual diapering or changing of the diaper for the child. We need to make sure to wash our hands using soap and water. It's very important that although we are going to be wearing gloves, it's still for safety purposes. We need to ensure that we practice good hygiene and we wash our hands and wear gloves. Um, the next step is going to be to place the child on the table or the mat. Um, Following step is going to be keep one hand on the child the entire time. This is very important. While you have the child on the changing table, you need to understand that this changing table is going to be a few feet off the ground. We need to make sure to secure the child at all times. We need to have at least a hand on the child at all times, because if the child, for whatever reason, rolls over, kicks, or anything like that, we do not want to have the risk of the child possibly falling off the table. So it's very important that we keep uh, a hand on the child at all times, no matter if they're on the floor, on the changing mat, or the changing table. Um, we need to make sure that I've seen a lot of staff, that they're going to change diapers and they take quite a few kids with them, 3 or 4 kids at a time into the restroom to change diapers. We need to make sure that if you are going to be doing that practice for whatever reason, if you really have to, we need to make sure to ensure that all the kids that are going to be in the area they're at back as much as they can. We need to make sure to prevent the spread of any germs or anything like that. So we need to make sure to keep them back as much as we can. Okay. Um, First step is going to be to remove the child's clothing, remove the dirty diaper. We're going to make sure to loosen the diaper tabs and roll the diaper inward. Like, we need to prevent having contact with the poop as much as we possibly can, because there's a big risk for getting any type of diseases or anything like that. So it's very important that we roll the diaper inward and try to avoid as much as we possibly can contact with any poop or anything like that. Okay. The next one is going to be to place the soiled diaper directly into the designated waste container. If for whatever reason you cannot reach the container, we need to make sure to place that dirty diaper as on the table, but it needs to be out of the reach of the child. Okay, so that's if for whatever reason um, you cannot throw the diaper right away. We need to make sure to keep it away from the child's reach as much as we possibly can, which is going to be the next step, which is going to be place the diaper directly into a designated waste container, or place to one side, making sure to keep it away from the child's kick space or reach. That's very important. We need to make sure, and then after that, you're going to be using your wipes to clean the skin of the child. We need to make sure to go from front to back, and we need to make sure to clean the little creases that the child might have. Make sure to get everything clean. We don't want any risk of any risk of rashes or anything like that. So we need to make sure to clean the child well. And then after that, you're going to place the soiled wipes again, either directly into the trash can, or for whatever reason, to the side with the diaper, and ensuring that it's out of the reach of the kids. Okay. Um, After that, we're going to dry the child's bottom well. We're going to replace the paper under the child if it is dirty. When putting the new diaper, we need to make sure that it's a clean area. Uh, then we're going to put on the clean gloves and dispose if designated waste container, or place. You need to dispose of your gloves afterwards as well. And then after that, we need to make sure if we have a permission from the parents to use any ointment or anything like that, baby powder. We do need to have the dispensing of medication form filled out by the parents and signed. If we are going to be using any ointment for rashes or anything like that, we need to make sure to have that documented. And if we do, then you can go ahead and apply um, that ointment uh, on the child. After that, you're going to go ahead and diaper the child, and then dress the child. Um, Again, to emphasize the fact that we cannot use any baby powder, any ointments, or anything like that unless we have documentation from the parents stating that we are allowed to use that on the child. I know it's hard sometimes if you do see a child that has a rash and you have the ointment available. I know it's easy for us to do it if the child has a rash, but you will have an upset parent if we do not have their consent or permission. So it's very important that we let them know if there is any rashes or anything like that, and we get the permission assigned by them. That's very, very important. As soon as you're done changing the child, we need to make sure to wash her hands. And the child's hands, even though they didn't have any contact with a diaper or anything like that, just to make sure that we minimize the spread of any infections, any germs, anything like that. We need to ensure that we are practicing proper hygiene in the classroom. And then after that, you get to go ahead and return the child to the play area or the crib. And if you have multiple children, then we will continue to follow the process over and over again for each child. That includes changing the paper for every single child, getting all the different diapers or pull-ups if it applies to it. You need to make sure to get all the different diapers or pull-ups for those children. We need to make sure that for every single child that we wash our hands. I know that it, you might have a short amount of time and you want to change as many diapers as you possibly can, but it's very important that we practice proper hygiene. Um, we need to prevent the spread of any diseases as much as we possibly can. And I'm going to keep emphasizing it and emphasizing it. It's very important that these are small steps that can be skipped, but if you do skip it for whatever reason, there can be a spread of a disease, and then it can be lead to a whole. It can lead to a lot of chaos. So we need to make sure to follow all of these steps. Washing our hands before and after every single child. Um, we need to make sure to follow that rule. Okay. Also, we already went ahead and went over the fact that we need to dispose any dirty diapers or anything like that in that designated container only. Okay. We are going to have multiple trash cans in the classroom, so but we need to have one designated trash can for only diapers. Okay. So it's also very important for us to follow that. Uh, we don't want to be throwing a dirty diaper in a classroom trash can, and you might have, might be risking it if a child opens up a trash can. You know, just saying, it's a what if he opens that trash can and gets the diaper. You don't want to have that risk. So we need to make sure that we label that trash can only being used for dirty diapers. Okay. Um, we need to make sure that at the end of the day we dispose of all of that container. Usually y'all don't have to worry about it because you do have a custodian at your center. He or she will do it. But if you do have to do it, we need to make sure to do it at the end of the day. Okay. For those staff that do not have a diaper changing table and you have a diaper changing mat, we need to make sure that we sanitize it after every use, okay? Which I will go over on how to properly sanitize and disinfect an area later on in the presentation, okay? Very important, again, make sure to wash your hands, not only you, but the child as well, um, for at least 20 seconds, continuously scrubbing, okay? Um, After every diaper change, we need to make sure to record the time that it was done and by who it was done, okay? If you do have any concerns, for example, if they have diarrhea, if they have a rash, if they have an unusual color in the poop, or maybe they're just constantly going to the restroom, if this seems like there's any concerns, we need to make sure to report it to the parent and also to your area manager so they can be aware of it. Um, Also, like I mentioned before, in order for us to use any ointment, we need to receive consent from the parents that we are going to be using that ointment on the kids. Now, I'm going to go ahead and go over the exclusion from outdoor activities procedures. Niños in Head Start and early Head Start will ensure that children's health and safety will be addressed by excluding them from certain outdoor activities due to health conditions, weather, or pestilence. Now, if the child is being excluded from outdoor activity due to a health condition, we need to have some sort of documentation. If by health condition, it can mean maybe the child has asthma and he's unable to participate in any physical activities. we need to have that documented, or for whatever reason they have maybe a disability or anything like that, um, we need to make sure to have the documentation on file from the doctor, okay? Um, and then we can make the necessary accommodations for the child if it needs to be made. If the child, for whatever reason, does have a disability that prevents them from participating in outdoor play, we need to make sure to, or any type of disability actually, we need to make sure to refer them to the disability content area, which is going to be Carmen Reyes. We need to make sure that the child receives the services that they need to. If they have autism, ADHD, if they have autism, ADHD, if they have Down syndrome, spina bifida, anything like that, we need to make sure to make the proper referral. And the department that can facilitate you guys with that will be the disability content area, and they will work on getting, them referred to the public school district, and we can work on getting, the proper training or the proper steps on helping the child, participate in, the big goal is to have everybody participate together in all the activities that we have at the center. So if we do have somebody with disabilities, we can probably get them other accommodations so they can be able to participate as well. But if they have any other conditions, for example, asthma, anything like that, we need to make sure to document it as well. If for whatever reason your child has a health condition and is not feeling well enough to play, and if it is a big concern, we need to make sure that we figure out if there's anything going on. If he has the flu or anything like that, we need to figure out what's going on, and we need to determine whether or not the child needs to be sent home to be taken to the doctor. Okay, so now exclusion from outdoor activity procedures continued. Now exclude children from outdoor activities due to weather. The only time, and this is going to be a lot of common sense. So obviously, if it's raining outside, we are not going to be going outside to play. And I know that you guys, you teachers have a lesson plan in case it is raining outside. You do have your rainy day activities to do inside. If it's too windy, we also cannot go outside if it's too windy. Anything that can probably, it's going to be a safety concern if for whatever reason things can be, flown or picked up or anything, and it can possibly hit a child or anything like that, then that will be what we would consider too windy. If it's too cold, I know it says here below 50 degrees, but sometimes it can be, it's all going to be based on your own assessment. Sometimes it can be 65 degrees outside, but it will feel like 50 degrees because of the air or because it's raining, or it's all going to be based on how you think the situation is outside. So we need to make sure we make the best decision, not only to protect our children but to also protect the staff. Now, we don't want to have the kids running around in 65-degree weather if it feels like 50, or obviously if it's below 50 degrees, then we do not want to be outside. Now, if it's too hot, we can also not go outside. Those playground structures can get extremely, extremely hot to where it can possibly burn the children's knees, hands, or anything like that. So if it's too hot, especially here in the valley, it gets extremely hot. It can be 95 degree, but it feels like 110. So, like I said, it's all going to be based on your um, assessment of the situation. Uh, we need to make sure to make the best possible decision for ourselves and for the kids. Also, if the ground is wet, um, we cannot go outside. And just because because of mud or anything like that, the risk of the structures being wet, kids falling, slipping, um, we do not want to take that risk and take the kids outside. I know kids love playing outside, but we need to make the best decisions when it comes to our kids, okay? Or any other weather conditions that warrants that the children be kept indoors. And that's in case there is um, anything on the news that states, for whatever reason, kids please or nobody be outside for today or whatever. Um, those are rare conditions, but if they do happen, um, anything that needs for us to stay indoors, we need to follow that as well. Now, we need to also exclude children from outdoor activities due to pestilence when there are too many mosquitoes. That's a big one. Although we do provide off for the children and for the staff, if you know that there's too many mosquitoes, for example, like today, due to all the rain here in the valley, it is unbearable to be outside because it's like you're being attacked by 1,000 mosquitoes. We do not want to have our kids in that environment to where even if they have off on, there's just too many mosquitoes due to the rain. So that's just also going to be common sense. We just need to make sure to keep in mind the child's well-being and safety. So if there's too many mosquitoes, we need to make sure for them to not to go outside, even though we have off. So if there's too many ants, it has happened that ants do infest the playground area. We do not want to take the kids outside and then for them all to get bitten by a bunch of ants. It's just going to be at least to you know it's just not a happy situation that you want to be in, not for yourself or not for kids. If there's too many bees or wasps, if for whatever reason there is a wasp nest or a bee's nest close by, we do not want to have the risk of a bee or a wasp stinging the children. So we need to make sure that we make the proper decision when going outside. And the big one is going to be if there is any insects, for example, bees and wasps, uh, that can possibly endanger the kids, or if there's any animals, any stray dogs, any raccoons, possums, anything that can endanger the children. We need to make sure that first of all we report it to our center director or your area manager, so then they can go ahead and contact the exterminator or pest control as soon as possible. Now, just to sum up the exclusion from outdoor activities, it's not just because we don't want to go outside. Let's say, "Oh, I don't feel like going outside today." No, we need to make sure that it is 100%. You cannot go outside for the following reasons. Being too mosquitoes, too many ants, health conditions, or it's just too hot or too cold, too windy. We need to make sure to make the proper assessment and the proper decision when going outside. Okay. Now we are going to go over hand washing. Hand washing is one of the most important practices that we can do at the center, not only for the staff but for the children. Um, right now, due to the current situation, which is the COVID-19 pandemic, this is the big one right here. Hand washing is going to be the biggest one, just because germs can easily be spread through you might not consider it, but a simple high five, handshake, touching of the face, touching of the ears. Kids are very interactive. Kids will be kids, so it is going to be hard for us to control the kids when you're at the center, because kids are kids. So we need to make sure that we have frequent hand washing and that we do hand washing correctly, um, not only for ourselves but for the kids as well. So Niños Inc. Head Start and Early Head Start program will ensure that all employees will teach and model hygiene practices in order to lower the risk of spreading communicable diseases through hand washing. Communicable diseases include the flu, strep throat, uh, and right now, sadly, COVID-19. So we need to make sure that we practice proper hand washing and we teach the kids proper hand washing. Staff and all other personnel working in the center will participate in modeling and teaching hand washing techniques. Um, and these are going to be the times that we are going to be washing our hands at the centers. So as soon as the kids walk into the center, we have to have them wash their hands before and after prepping and serving food. This is going to be very important for the cooks and for the teachers. Um, I am not too sure. We're still going to be practicing family style like we used to before the pandemic, which was going to be when we had the children serving each other, and that we would all sit together in the same table, family style, like a Thanksgiving dinner. I'm not too sure, but if we are, for whatever reason, are going to continue doing that, we need to make sure that the kids are going to be helping serving food, or the teachers that are serving food, make sure they wash their hands. Also, teachers, if you are going to be using the restroom, and if also the kids are using the restroom, we need to make sure to wash our hands afterwards as well. And if you are going to be cleaning the restroom, we need to make sure to wash our hands as well right after. Like I mentioned before and after meals. If you are in contact with any bodily fluids, which is mucus, blood, um, anything like that, we need to make sure to wash our hands as soon as we possibly can. Before and after putting on gloves, this is going to be during the diaper changing process that we just went over. Before and after putting on gloves is we have to wash our hands. After you attend to a child that has any ear, eye, or nose drainage, which is also going to fall under bodily fluids, we need to make sure to wash our hands as soon as possible. After handling sold items, which is going to be the diapers or a Kleenex that has mucus on it, anything like that, we need to make sure to wash our hands. After inspecting for any head lice, before and after giving medication, after handling the trash, and before and after diapering. These are just very important. Sometimes, like I said, it's easy for us not to do it, but this is a process or a procedure that I feel like we need to make sure to follow um, without a doubt. Now, hand washing procedures continued. Hand washing will be conducted using the following best practices. This is going to be the best way to wash hands, which is going to be you're going to first of all wet hands with water. You're going to then apply soap. Then you're going to lather your hands, making sure to rub the front and the back of your hands under the nails. And then you're going to make sure to rub your hands vigorously for at least 20 seconds. Usually, just have them sing a short song and and wash their hands también. That's also going to help them, make sure to practice proper hand washing. Um, then after that, we need to make sure to rinse our hands and then grab a paper towel, dry our hands. And this is very important, and not a lot of people do it, but I know that if we show the kids properly and we do it as well in front of them, that they'll follow it. Is that we need to make sure that that paper towel that you're using is what you use to stop the water from flowing, and then have them throw it. I feel like that's going to be the best practice just because you want to avoid, you just wash your hands, and if you touch a dirty handle, it kind of defeats the purpose of washing your hands. So I know that's a very important one that we should follow for sure. We also going to make sure that all staff also teach the kids the following steps that I just went over. If for whatever reason you are unable to wash your hands, now I'm not saying um, you are allowed to use hand sanitizer. Now I'm not saying that using hand sanitizer is going to replace hand washing. It is not going to replace hand washing. But for whatever reason, if you cannot wash your hands, you are allowed to use hand sanitizer. Um, but to emphasize, it does not replace washing your hands. Hand sanitizer is just going to kill the germs. It's not going to remove any dirt that's under your nails or any dirt in your hands. Okay, it's um, best practice would be hand washing. Okay. Now we're gonna go ahead and start going over disinfecting of the mats toys. These are gonna be the procedures that we must follow for Head Start. Niños Inc. Head Start and Early Head Start program will ensure that center toys and mats are kept clean in order to prevent the spread of any diseases. For children 2 years 2 years old and over, mats will be disinfected with a bleach solution, which I will go over uh, right now in a few more slides, once a week or as needed. Toys will be disinfected with the bleach solution once a week or as needed. Staff will wash their hands before and after disinfecting procedures. And after disinfecting, staff will wear gloves while disinfecting all surfaces. Now, for early Head Start, toys must be disinfected weekly and sanitized daily. For early Head Start, it's very important because you are working with babies or an infant, so it's very, very important that we sanitize them on a daily basis. This is also the case for Head Start, but for early, it's very, very important because you do have babies that will put these toys in their mouth all the time. So we need to make sure to sanitize them every single day. For Head Start and early Head Start, it's going to apply to both. Mats will be labeled with the child's name. Mats will be sanitized daily or as needed. Mats will be disinfected every week and as needed. Mats will be stored in a clean, designated area and off the floor. Usually, this is in the closet area where they're going to be stored. When the child is feeling ill and they get sent home, we are allowed to have the child lay down on one of the mats, but as soon as the child does go home, we have to sanitize that mat that the child was laying on, okay? Now, for Head Start, mats will be covered with a towel or sheet, preferably white. And the reason we use white is because white you can easily identify if it's dirty, for whatever, if they have boogers or if the child pees or anything like that. We're able to see if if the sheet is white. Usually, we have the parents bring that for the child, but if for whatever reason the family is unable to provide it, we can provide it for the kids, for the children. This sheet that's going to be used for the mats or the cots will be taken home every Friday so the parent can wash it at home. Parents will return the clean sheets or towel to the center on Mondays for the week's use. So when setting up the mats for nap time, the mats will be spaced 3 feet apart. Now, right now, due to COVID, it is going to be 6 feet apart according to CDC guidelines. I know in the CDC guidelines also states that it can be 3 feet now. So let's just, I feel like right now we're going to stick to the 6 feet apart, due to COVID. And that's going to not only give you safe space for the staff to be walking around, but it's also going to prevent the spread of any diseases. Right now, we're going to go over the procedures for nap time. For early Head Start, we provide all the sheets for the kids because since they are going to be in the cribs, we do provide, and I think early Head Start also has their own washing machine, so that's why we do provide them with their own covers, for their mat cots. Sorry about that. Now, for to continue, crib blankets will be furnished, like I mentioned, by the agency and will be washed daily. Mats and cribs will be spread 3 feet apart, also to allow the passing of the staff and to prevent any spread of communicable diseases. Uh, Now, this is going to be the guidelines for disinfecting. All surfaces can be safely disinfected with a mixture consistent of 1/4 cup or 4 teaspoons of bleach per gallon of water. 1 teaspoon bleach to 1 quart of water. That's if you're going to be using a quart. So it's very important that this mixture gets made on a daily basis, and that's so it can maintain the strength that it needs to kill the germs. The longer you leave it in the container, the less effective that it's gonna be when killing any germs. It's very important that the bleach that we use, it doesn't matter what type of brand it is. So make sure to know that that it's not important what bleach it is. It does not have to be the Clorox brand as long as it's bleach. Then you're gonna go ahead and mix it. Make sure to mix it with cool water. And the reason it's with cool water, if for example, I don't know if you ever put Clorox in hot water, you can smell it. It's really, really strong, and we don't want that. We want to prevent you guys from inhaling any Clorox as much as we possibly can. So make sure to use cool water, not hot water. Uh, Surfaces and objects which are dirty should be cleaned with the soap and water. So you are going to be making different containers for each solution. Okay, the first solution is going to be soap and water, and then there's going to be one with just water, and then when you're just going to have your Clorox solution, which is going to be the one I mentioned first, which is going to be the quarter cup of bleach to 1 gallon of water. Okay. Bleach mixtures will be applied to large objects by spray. Small objects may be dipped to the bleach and water mixture. So it just depends. You can also spray any toys with that same solution, but the best way to disinfect toys will be to put them in a container and then fill it with that water and bleach solution. After that, we need to make sure these usually we disinfect at the end of the day, so we need to make sure that give it a lot enough time for that solution to dry on its own. So that's going to be very important. We do it at the end of the day, and we need to make sure that we allow it to air dry. Now for sanitizing, we're going to wash with water and soap, which is going to be your first container. Then you're going to rinse with water, which is going to be your second container, your second spray bottle. And then after that, you're going to spray with the disinfectant solution and let it sit for at least 10 minutes before you go ahead and rinse with cool water and wipe it off with a paper towel. Or the best, like I mentioned before, the best practice is going to be to allow it to air dry. Okay. Now I'm going to go ahead and go over the napping procedures. Using Head Start and Early Head Start will ensure that children will be given time to rest in safe, comfortable, calming, and sanitary manners. Procedure applications for Head Start and Early Head Start. Children, mats, cribs, and cots will be placed 3 feet apart. Like I said, right now due to COVID, we are doing 6 feet, but that just depends on which procedure we follow from the CDC because we are CDC does state that it can be 3 feet and also 6 feet. So keep that in mind also. Also, nap time will not exceed more than 3 hours. In early Head Start, infants' rest periods will allow the infants to maintain his or own sleeping pattern and waking periods. In early Head Start, an infant may remain in the crib or other confining equipment for up to 30 minutes after waking up, as long as the infant is content and responsive. So, as long as they're okay with being in the crib after they wake up, that's okay. We can go ahead and leave them there for just for a little bit longer. In early Head Start, infants not able to turn on their own must be placed in a faced up sleeping position. It's very important. Unless the child parents presents written documentation from the healthcare professional stating that a different sleeping position is allowed and that will not harm the child. Infant heads, faces, or cribs will not be covered by items such as blankets, linens, or clothing at any time. When using mats or cots, children will rest in alternating head and feet positions in order to prevent the spread of diseases. We will usually, like that picture up below, that's going to be the way we're going to be setting up the mats and also the cribs, just in case we do not want a child just to turn over and then sneeze or cough on another child. So this will prevent that from happening and also prevent the spread of any diseases as well. During nap time, entrances and exits will not be blocked by any children's mats or cribs. We don't want, somebody walking in, open the door, and then a child crib or mat is there, and we hit the child. We need to make sure to avoid any entrances or exits. Mats will not be set up during any activities or left in place to interfere with child's activities. And this is a very important one. Not make sure that just because you have the children in carpet and in circle time, that you're setting up mats, or while they're running around or doing any type of center, if they're in their stations, we do not want to be setting up just because we don't want them to trip or fall. So it's very important that we make sure not to be doing it, while the kids are playing. Children will rest with their shoes off. Children are going to be allowed to take their shoes off. Staff will assist children to remove and put on their shoes. Mats, cots, and cribs will be covered so their face does not touch the vinyl, which is going to be for the. This is the reason why we ask for them to bring their own sheets. We don't want to have their face on the cot just because it's plastic. And it's going to leave a lot of marks for the child. Um, there's also a calming transition activity must be incorporated to get the children ready for rest time. Quiet activities will be provided to children who do not wish to sleep. For example, if you do have a child who does not like to sleep, you can have them read a book, color, just keep them occupied. We're not gonna force the child to go to sleep if they don't want to. We're still gonna be following proper child staff ratios during nap time. Just because the children are asleep doesn't mean that only one staff can watch the entire classroom. We need to maintain two staff at all times supervising the children while they are sleeping. Staff supervising children during rest time may not perform any other duties during rest time. So just because the child is asleep doesn't mean you can be working on your lesson plans, working on your paperwork. Your attention needs to be on the children at all times. We need to make sure that we don't want them to have any problems while they're asleep. So that's very important. Or for whatever reason, if you have your phone or an Apple Watch or anything like that, this is not the time for you to be doing it just because the children are asleep. So your main concern should be the kids at all time. Uh, Natural lighting or soft lighting must occur during the rest light. So we can dim the lights. You can turn off one light, for example, just to make it a little bit more soothing for the kids, or bring down the minimize the amount of light that comes in. But that does not mean to turn off all the lights to the point where you cannot see anything. It cannot be completely dark because then we can't supervise the kids. So that's very, very important that we follow that. Staff will assist children on hair brushing right after they wake up. Uh, and this is just to promote personal hygiene. So when the children wake up, yeah, they're all their hair's all over the place, especially for the little girls. We do provide them all each a comb and a brush. So this is going to be the time that we do brush their hair, and we can also take this time to actually teach the kids how to brush their own hair. And this is just going to allow them, to practice proper hygiene, and also, promote for them to be independent on their own by brushing their own hair. Now we're going to go ahead and go over the toileting procedures. Niños Inc. Head Start and Early Head Start program will assist the child to ease the transition from diapering to using the toilet. Now the staff will assist the child when the child is physically and emotionally ready for toileting. The first sign of readiness is the awareness that the child is wet and or he has pooped himself. The child must identify the feeling of being wet and recognize the body signals. For example, shaking. They need to be able to identify the fact that they're gonna about to go to the restroom before we can start teaching them to toilet, to potty train them. Teachers and parents must learn to trust the child, help and guide, and love unconditionally, support and let the child do it themselves. Um, we need to be the motivation for the kids, not make them feel bad. Uh, this is actually the first one of the biggest steps in teaching a child to be independent is going to be potty training. So it's very important for us to trust the children and give them the feeling that even if they make a mistake for whatever reason, maybe they don't make it in time, or they didn't clean themselves, or for whatever reason, an accident happens, we need to make sure to help the child. and show them that you're still there to support them and not make them feel bad to where they're no longer going to be able to do it. Like I said, this is going to be one of the most important times that the child learns to be independent and no longer have to rely on you guys changing their diaper. Or so this is a very critical time for the kids. So there is going to be a lesson plan uh, to teach kids potty training. This is going to be the best time, to teach the kids how to properly do it. And this is going to be by reading books. And teachers, you're going to be the number one person for them. Um, you're going to make sure that they understand the urge of having to go to the restroom, what it means if you feel like going to the restroom, what it means, what it means, which is going to be going to the restroom and then being able to tell you that they need to go to the restroom, and then for them to understand the process, taking off, taking off your shorts, pants, being able to show them how to take off their diaper or their pull up. We need to make sure that this is the best, that you teachers are going to be the reinforcements for them, and it's going to be done during your lesson plans, maybe by watching any videos, reading a book, or even just talking to them and describing how to do it. You guys are going to be the number one teachers for them when it comes to potty training. It's also very important that we keep the parents in the loop. Maybe so whatever you're doing at the center, they can do it at home as well. You don't want to give them mixed messages. Maybe you're teaching them something at the center, but mom and dad are teaching them something completely different at home. You don't want to confuse the child uh, either. So it's very important that we have that good communication with parents as well. Um, Teachers must include, like I mentioned, potty training into their curriculum, uh, and also remind parents that they do need to be providing a change of clothing since there are going to be potty training. Accidents do happen, so we need to make sure to have the clothes there, at all times at the center in case there is an accident. We're able to change them if we have to. Like I mentioned, parents will be asked to bring a change of clothes, which will be kept in the children's cubby. Uh, we need to make sure to let parents know to keep them in comfortable clothes. We don't want to have a little girl or a little boy in a pants and have a pants on that has 5 buttons in it, and it's just gonna make their life difficult. Something easy to where it's gonna require little assistance is the best thing to do. So I know parents like to have their children dress up nice and really elegant, or but we need to make sure to remind them that we want to help them, not make things worse for them. So we need to make sure that let parents know that dress them in proper clothing. You know, Also, if for whatever reason the child has an accident, like I said, be the support system for them. Don't make them feel bad. Make sure to help them, support them in whatever they need. Just to go back on toileting, I mean, also like I mentioned before, uh, only one child per toilet and per sink. You don't want to have a lot of children, you know, in the restroom at the same time. So that's very important as well. Also, we need to make sure that staff supervise the children at all times while they're practicing their potty training. We need to make sure for us to be there all the time, not walk out, anything like that, because child can slip, fall, hurt themselves, and we need to be sure to be supervising them at all times. Uh, when they're going to be going to the restroom, for not only for potty training, but if they just need to go to the restroom, period, we're going to have only they're going to have a designated restroom for boys and girls. And if they are sharing, only one boy at a time and one girl at a time. Don't have a boy and a girl there at the same time just because you want to do everything at the same time. No, make sure to have one boy, one girl at a time if there is only one restroom. If there is a boy restroom and a girl restroom, we need to make sure to be supervising them. You need to be supervising them at all times. So don't have two kids in two different restrooms at the same time in one staff. No, you need to find a system that works for you where you can supervise the kids, um, while supervising them while they're going to the restroom, and make sure to supervise where there's no injuries occurring. So also, after they go to the restroom, make sure that they wash their hands, like we mentioned before. For the hand washing procedures, make sure to have them wash their hands. Okay. These are going to be the different stages of potty training, just so you guys can have a picture of what they are. When a child first starts potty training, there's going to be 4 steps that we're going to progress as they improve. Now, stage one, um, even though the child doesn't need to go to the restroom, we're going to be placing them in. We're going to sit them down in the toilet every half an hour. This is just in case we don't want any accidents, and they get to learn. Okay, if I need to go to the restroom, this is where I need to be. And we're going to be doing that for at least 10 days. If there's no accidents, we're going to also let the parents know every day what their progress is, if they did go to the restroom, didn't go to the restroom. But this is going to be stage one. Now, whenever they move up to stage two, we're going to put them in the toilet every hour now. Now, the goal here is to have to push away from actually having to sit them down. We need to be for them to be able to identify that they need to go to the restroom on their own. Okay, so stage two, we're gonna place them in the toilet every hour. Even though they don't need to go, we're still gonna sit them down every hour just so they can, in case they need to go, they're gonna go. We're gonna do this again for 10 days. Or if for whatever reason you have a child that is just flying through these steps, then you don't really have to. But then we're gonna show a progress report also to the parent every day as well, letting them know how they're doing. If they do good, then we're gonna boost them up to stage three. Uh, this is when we no longer have to sit the child in the toilet every half an hour. This time we're gonna ask them every half an hour. For in stage three, in this case for stage three, it's every half an hour. We're just gonna ask them, do you need to use the potty? Do you need to use the potty every 30 minutes? Okay, and we're gonna practice this for at least 10 days and give a progress report like the other steps to the parents every day, showing them how they're doing and how they're progressing throughout their potty training. Now, if they do well with you asking them every half an hour or 30 minutes, then we can progress them to stage four, which is we're no longer going to ask them. This time they're going to be going during the classroom schedule, which we have times during the classroom schedule where they go potty train, where they go to the restroom. So we're no longer going to be asking them. Now they're just going to go on their own. And also during this step, same thing as the previous steps, we're just going to ask them. We're going to give them a progress report every single day to see how they're doing at home, at the center, sorry. Um, the goal here is to not having to ask them anymore, where they can express themselves that they need to go to the restroom and able to raise their hand and say, teacher, I need to go to the potty. Uh, this is going to be once stage four is when they're going to be properly potty trained and no longer need to be seated in the toilet or no longer need to be asked if they need to go potty. They're just going to be able to do it on their own. And at this point, you all teachers can give yourself a pat in the back because your kids are going to be potty trained and you no longer have to do diaper changes or pull up, change their pull ups anymore. So you made it. That's going to be the end of the training. I know it's a lot of information that you guys already knew, but it's just going to be a little refresher, like I mentioned in the beginning of the training, on the procedures that we have in place for Head Start. I'm also going to take this time to just talk about a little bit about the COVID-19 pandemic. I know a lot of our staff, and a lot of the nation is already fully vaccinated, but although you're vaccinated doesn't mean you have zero the chance of getting COVID-19. I know, for example, the Moderna vaccine covers you 95%. There is still that 5% of getting COVID-19. Now, for us staff, we're still going to be required to wear a face mask. We're no longer required to wear face shields, but we're still going to be required to wear face masks. Now, face masks are provided to all the staff. My recommendation is every day you come in, wear a new mask. Um, you can bring your own mask from home, but we do provide enough masks for the staff to where they can have a new one every single day. Uh, so there's no need for you guys to be wearing the same mask over and over again. I know back then it used to be really difficult to acquire face masks, but I feel like now we are able to provide you guys with enough masks, for to have a new one every single day. Now, for kids, on the other hand, I know for the age group that we serve, we still don't have a vaccine for them yet. I hope soon in the future we're going to be able to get that vaccine for our kids. So um, it's very important that although we're not aware of what the kids are exposed to at home or the people that they're exposed to at home, uh, we need to make sure to keep the safety of ourselves and the kids in mind. I know that if the children are 2 years and older, they can wear a mask and they should wear a mask if they don't have any health complications. Which, like we mentioned before, any health conditions that the children do have, we need to make sure to have the documentation on file. Now, our babies, which is going to be 2 years and younger, are not required to wear masks. And personally, um, so we need to make sure to really, really take care and follow as much as these procedures as we possibly can for our little babies or infants, which are 2 years and younger, because in reality, there's no mask the size for kids, 2 years and younger. So we need to make sure that we follow all the procedures that we have in place just to prevent the spread of COVID-19 or germs or anything like that for our two year olds and younger. And for 3 year olds, for two and older, we need to make sure just to teach them, the importance of wearing a mask, especially during this time. I know right now it's not really required, to wear a mask anymore out in the public if you are vaccinated, but I think it's if we're able to teach our kids that the importance of wearing a mask, I feel like that's something that can be reflected on their parents, and maybe that will help out the situation, right now. Uh, but this is going to be touching on COVID-19. We're still going to be following the procedures for checking the temperature on a daily basis for our kids. We do have non-contact thermometers for the centers, uh, and we also have the thermometer screen for our staff. We want to continue these procedures just so we can prevent the spread of COVID-19. And we're also, I know I didn't mention when I was covering disinfecting and sanitizing, but we also now have a sanitizing sprayer, disinfecting sprayer that will be used at the end of the day. And the chemical that we are utilizing does kill 99% of the COVID, you know, virus from any services. But like I mentioned, it is used at the end of the day. So, maybe you can have that, ease of mind, that we are using that chemical at the center. Uh, so we still need to continue to practice the best, you know, healthy, good hygiene for ourselves and for the kids. Uh, I know it's hard because it's difficult for us not to control what the parents are doing, but we were able to control what we do, and it's very important for us to keep that in mind. Now, the training, I'm going to be providing a few links for you guys. But they're just going to be short videos, and this videos just to uh, reinforce the information you guys learned, which are going to be on little videos about COVID-19, and maybe some videos on hand washing and proper toothbrushing also. So I will be providing those links to you guys in the training as well. If you guys have any questions, any concerns, or you guys need some additional information on anything, You can always feel free to email me or contact me here at the administrative office. My name is Jorge Solis, and my email is going to be jorge.solis@niñozinc.org. Or you can always call the administrative office number here, and my extension is going to be 145. I'm happy to help you guys out in any information that you guys might need. If you have a concern, maybe you need a little bit of information or guidance, feel free to let me know. Okay, guys, I'm here to help. And thank you guys for participating in my training. Again, I hope you guys enjoyed your summer vacation. If you did have a vacation, if you're new, again, welcome to the program. Hope you guys stay here for a long time. We're a wonderful agency, and um, we do provide great services for our children and for our parents. And that will conclude my training. Thank you so much.